This is Princy, Associate Professor in Mental Health Nursing. We come across many clients who suffer from the neurological disorders. Okay, we have got various neurological disorders. One of the important neurological disorders is the convulsions, or we can call them as seizures. Right? So, when a patient goes to the neurologist, he may be prescribing certain drugs for control of seizure or management of these convulsions. So those groups of drugs are called as the anticonvulsant drugs, right? So the topic for discussion today is the anticonvulsants. Anticonvulsants or anti-epileptic drugs are the group of drugs which are used to treat the epilepsy or the seizure conditions. These drugs, in case of the psychiatric treatment, are used in treatment of certain conditions. So, especially the bipolar disorders. So, these anticonvulsant group of drugs are being used for the treatment of the mania, that they are replacing the drug lithium, which was primarily used for the treatment of mania, right? And also, these anticonvulsants play an important role in treatment of the mood disorders also. We have got the various types of the anticonvulsant drugs. So let us see the types of the anticonvulsant drugs. We have got the carbamazepine, the clonazepam, valproic acid, lamotrigine, gabapentin, and topiramate. So these are the various types of the anticonvulsant drugs which are used in the treatment of the seizure. Let us learn about each of these drugs in detail. So the first drug is the carbamazepine. The trade name of the drug is the Tegretol. So what are the indications of this drug Tegretol? You would have seen in the neurological department that this drug Tegretol is very commonly used, right? So what are the indications for this drug to be given? The first one is the grand mal seizure and the psychomotor seizure. We have got the bipolar disorder, wherein the client is suffering with the manic episode currently. In those conditions, also this carbamazepine can be administered. So another condition where it can be used is schizophrenia. So the type of schizophrenia which is called as a schizoaffective disorder. So both the conditions of schizophrenia and the mood disorders, they're coupled up. Then in those conditions also this carbamazepine drug can be administered. Moving on to the mechanism of action, the exact mechanism of action is unknown, but it is known to cause some alterations in the neurochemicals and nerve terminals. Right. So what is the pharmacokinetics of carbamazepine? So it is metabolized in the liver and it's excreted through the kidneys or through the renal system. This drug, carbamazepine, has got its own metabolism. So initially, when it is given, this drug, initially when this drug is administered, there will be an increased level of this drug in the serum. But later on, the effect of the drug in the blood just fades off, which requires more dose of the drug which has to be administered. As this is the reason, you can understand that the half-life of the drug is about 25 to 65 hours initially when the treatment is started, but later on as the days goes by or the weeks passes by, the half-life of the drug will get reduced to about 12 to 17 hours. So that is one of the important action of this carbamazepine, how the concentration of the drug in the blood is decreasing. Moving on to the dosage of the drug. So the initial dose of the drug is 200 mg, which is given in the divided doses. So the overall average dose of the drug per day is 600 to 1200 mg. So that is about the dosage of the carbamazepine. Moving on to the pre-carbamazepine workup. So before we even start the administration of the drug carbamazepine, we have to keep in mind certain important points and also educate the client and the family that these things should be avoided. Number one, certain medications and the substance use, right? So any kind of a substance, it can be substance of abuse, right? So various drugs. So all these should be avoided before we administer the drug carbamazepine, because it can have an interaction with these drugs and cause the adverse effects. The second thing that you have to educate and you have to do is you have to do the ECG, right? So ECG in the clients who are above 40 years, and also in the clients who are having certain cardiac conditions, you need to do the ECG or the cardiac monitoring before administering the carbamazepine. The third thing is make sure if it is a female client who is in a childbearing age, so the lady shouldn't have had any kind of a plan for pregnancy, or she shouldn't be pregnant before administering the carbamazepine because it can have teratogenic effects on the fetus. So that is about the drug carbamazepine. Moving on to the second drug, which is clonazepam. Let us see the indications of clonazepam. The first indication is in the case of abstinence, right? So if the client has opted for abstinence or complete cessation of the particular substance of abuse voluntarily, so in those cases we can administer this drug clonazepam, since once the client stops immediately taking a particular substance of abuse, there may be chances of withdrawal symptoms, right? Seizure, convulsions, so all these can also be the withdrawal symptoms. To avoid that, as a prophylaxis, we can also administer this anticonvulsant agent to calm down the client and to control these occurrence of the seizure. So we will be giving in the cases of abstinence. Second indication is in the akinesia. The next indication is a monoclonic seizure. So in those conditions, we'll be using the drug clonazepam. Another important indication in psychiatric condition that clonazepam can be administered is in the bipolar mania to calm down the client. Moving on to the dosage of the clonazepam. The usual dosage of the drug is 0.75 to 16 mg. That is the overall dosage of clonazepam. Moving on to the next group of drugs is the valproic acid or the sodium valproate. So widely used drug for treating the convulsions. Let us see the indications of valproic acid. It is used in the absence seizure bipolar disorders, especially the mania. It is also used in certain migraine conditions and also as a prophylaxis to prevent the occurrence of the seizure in certain conditions. This drug, sodium valproate or valproic acid, can be used. The average dosage of the drug is 500 to 1500 mg. Moving on to the next drug, which is lamotrigine. What are the indications of this drug, lamotrigine? It is used in the generalized tonic-clonic seizure, in the myoclonic seizure, and also in the bipolar disorders. What is the dosage of this drug? The dosage is 100 to 200 mg. Moving on to the next drug, which is gabapentin. The indications of gabapentin is partial seizure, epilepsy in adults, as well as the bipolar disorders. So that is the indication of the drug gabapentin. The average dose of the drug is 900 to 1800 mg, which is the topiramate. Right? The indication of the drug topiramate is partial onset seizure and the bipolar disorders. The dose of the drug is 50 to 400 mg. Let us see the contraindications of the drug. The first contraindication is hypersensitivity reactions, right? In case of glaucoma, this drug is contraindicated. In case of lactating mothers, the pregnant mothers, individuals who are having any kind of liver disorders, cardiac disorders, and the hematological disorders. So these are the contraindications of the drug. Moving on to the side effects, we have got the general side effects like nausea and vomiting, drowsiness, dizziness, prolonged bleeding time, and the risk of developing the hypersensitivity allergic reactions onto the skin. Sometimes these side effects are very much life-threatening, can be fatal. So we have got the other side effects like thrombocytopenia, agranulocytosis, and aplastic anemia. So these are about the side effects, and this is about the drug anticonvulsants. So mainly these group of drugs are used for treating the convulsions or the seizure, and also it can be used in certain psychiatric disorders, especially in case of the bipolar disorder. Many times these are affective disorders wherein the client is also having the seizure, and mainly it can be used in the people who have opted for the abstinence to control the withdrawal symptoms. Hope you all have understood the topic. Thank you.